Hello, and welcome to Introduction to Radiology Medical Coding. In this video, we'll walk through the journey of a medical imaging exam from the initial order to the final report. I'm excited to guide you through this process, which ties together everything we've learned so far. Section 1, the Radiology Order. Every radiology procedure starts with an order. Doctors request imaging for many reasons: diagnosing illnesses or injuries, evaluating patients before or after surgery, screening for certain conditions, or monitoring how well a treatment is working. The patient's signs and symptoms help determine which imaging test, like an X-ray or MRI, is the best choice. For example, shortness of breath might lead to a chest X-ray, while joint pain could call for an MRI. The important thing to remember is necessity. Every order must be justified. Random or unnecessary tests are not approved by insurance companies. As a coder, you'll use the order to understand the reason for the exam and make sure your codes match the clinical intent. Section 2, the Radiology Report. Next comes the Radiology Report. This is the radiologist's main way of sharing imaging findings with the care team. The report is dictated and transcribed, and it reflects the radiologist's expertise and their role in patient care. A clear, detailed report can mean the difference between a quick diagnosis and a missed opportunity. As coders, you'll rely on this report to assign the correct CPT and ICD-10-CM codes, so understanding how it's structured is critical. In short, the Radiology Report is the radiologist's direct work product and one of the most important ways they contribute to patient care. Section 3, the Components of the Radiology Report. Let's break down the components of a radiology report. Demographics. This includes the facility name, patient's name, age or birth date, gender, referring physician, exam type, date, time, transcription details. It sets the stage. Relevant clinical information. Why was the exam ordered? This section lists the reason, like shortness of breath, and any pertinent history or comparisons to past exams. Technique. This section describes what contrast or radiopharmaceuticals used, with specifics like dose or route, medications, devices, and complications. This area is also where scan details are reported, such as 3D reconstruction documentation. This area might be omitted in general radiology and replaced with views done instead. Findings. The bulk of the report describing what the radiologist sees using precise anatomic and radiologic terms. This includes potential limitations. Any factors like patient motion that might affect accuracy. Impression, conclusion, or diagnosis. The takeaway. A specific diagnosis, differential possibilities, and follow-up recommendations. Serious adverse events are noted too. Final report, proofread, signed, often electronically, sent to coding and billing before being sent to the referring provider. It's archived and available to the patient with consent. Section 4, Radiology Report Example. I'll walk you through the report demographics line by line. The first part of the chart should include all unique patient identifiers and numbers linked to the visit, such as date of birth and medical record numbers. In large institutions with many departments, patients are classified into outpatient, inpatient, emergency, short stay, and day surgery. The location of the patient encounter will reflect on choices made for billing, and the financial class is related to the patient's type of insurance coverage. MD. This is documentation of the ordering provider, the person who is ordering the radiology exam. Date of service, DOS, December 28, 2022. Time in 24-hour format, 0228, 0228 a.m. The date of service is when the exam was performed, with the time the exam was conducted. The medical profession uses the 24-hour time format for clarity in charting, and this time format is built into charting electronic medical records. Accession number, XR22-1234567. This number is assigned to the exam by the PACS system, Picture Archiving and Communication System, a medical imaging technology used in healthcare organizations to securely store and digitally transmit electronic images and clinically relevant reports. PACS eliminates the need to manually file, store, retrieve, and send sensitive information, films, and reports. Each exam has its unique accession number. Order CPT 71045, Order exam, port chest 1 view. Reason, shortness of breath. Before an exam is performed, it must be ordered. Electronic medical records include clinical order entry with CPT codes built into the requested exam. These orders let the radiology department know what exam to do and why. Same-day related notes, none. This area contains information about the other radiology exams performed that day. This section lets the medical coder know if there will be conflicting exams that may need modifiers. Header, AP Portable Chest Radiograph. The header is the report area where views are documented. This line of information is vital for coding general radiography exams. The number of views done should match the report's order CPT code and order exam description. This confirms the view anteroposterior portable 1 view, matching the order. History, shortness of breath, the radiologist's documentation of why the exam is being performed. Comparison, chest radiograph, May 20th, 2022. Documentation of the last exam done at that facility. This exam is located in the PACS system. If the patient comes to the facility with outside images and the radiologist uses them, it will be documented here. Findings. The cardiomediastinal silhouette is unremarkable. No focal airspace opacity, no pleural effusion or pneumothorax, no acute bony abnormality, bilateral acromioclavicular joint degenerative change. The main section of the report. Radiologists have specific criteria to look for in each exam, and it will be documented in this section. Impression, no acute cardiopulmonary disease, the diagnosis of the report. Impression, a specific diagnosis should be given and a differential diagnosis rendered. Follow-up or additional diagnostic studies should be suggested to clarify or confirm the impression. The impression should note any known significant adverse event involving the study's performance. As a coder, you'd use CPT 7145 with modifier 26 for the single-view chest X-ray, and an ICD-10-CM code R6.02 for shortness of breath, the reason for the X-ray. Because the X-ray was read as negative, nothing causing the shortness of breath noted, you code the medical necessity for the X-ray. In this case, the reason for the X-ray, shortness of breath. Finalized by radiologist, MD, the name of the doctor who read the images. If a radiology resident reads the images, that information will be included in this area. Thanks for watching Introduction to Radiology Medical Coding. We've traced the imaging exam from order to report, covering the radiology order, report components, and a hands-on example. Congratulations, you've built a solid foundation in radiology coding. You're now ready to turn reports into codes with precision. To help you follow along and review what you've learned, I've created a free downloadable PDF with the lesson outline and key notes. Just click the link below this video to access the free PDF now. This resource is perfect for reviewing concepts, taking notes, or studying at your own pace. You can view it on my website or download the entire course PDF, which includes all 5 written lessons, each with detailed outlines and notes that match the video content, links below. Don't forget to download it, and I'll see you in the next lesson.